Eating disorders are a choice. Fact: eating disorders are mental health disorders and are never a personal choice. They are complex illnesses which have no single cause. Instead, they are thought to be caused by a combination of factors. Eating disorders can be extremely distressing for both the individual and their loved ones, and are often accompanied by feelings of shame. They require specialist treatment, but people can and do get better. Myth: you must be underweight to have an eating disorder. Fact: when people think of someone with an eating disorder, often they think of people who are significantly underweight. Although weight loss is a symptom of anorexia nervosa, most people with an eating disorder stay at an apparently healthy weight or are overweight. There are many eating disorders: bulimia, anorexia, binge eating disorder, or SVED. Either way, your struggle is valid, no matter what eating disorder you have or what your BMI is. Some people do need to restore their weight. However, this is only one aspect of treatment, and being weight restored does not mean that that person is recovered. Eating disorders are mental illnesses, not physical. Changes in weight are only a side effect or a symptom. Myth: eating disorders only happen to young girls. Fact: although eating disorders are more common among women, they do not discriminate. They affect people of all genders, ages, ethnicities, sexual orientations, weights, and socioeconomic statuses. Myth: eating disorders are just about food. Fact: although eating disorders generally involve obsessions with calories, weight, or shape, they typically develop as a result of attempting to gain a sense of control, which they otherwise may feel is lacking in their life. Assumptions that eating disorders are just about food can often lead to comments like, just eat more, just eat less, or just eat healthier to be cured of this illness. However, eating disorders often require some combination of medical, psychiatric, therapeutic, and dietary intervention to achieve full recovery. Myth: eating disorders are caused by the media. Fact: many people are exposed to the media on a daily basis, but only a small percentage of them actually develop eating disorders. Eating disorders are complex and serious illnesses that have biological, genetic, and psychological roots. The media can certainly impact how a person feels about their looks and promotes a great deal of pressure to look a certain way, but the media does not cause eating disorders. So remember, eating disorders are very serious and even deadly illnesses. They are not just about food, and they don't just affect women. People get eating disorders at all ages. People can be any weight or body type and have an eating disorder. Recovery is possible. If you know someone who is struggling or struggle yourself, please reach out.